Decided to lighten this talk, and we regularly review some of the demographics and statistics of our practice, and we like to put them in periodically and upgrade them. This is a recent upgrade. The average weight of our babies we deliver is about 7 pounds 3 ounces, average, and that is a very reassuring thing for everyone. And obviously there are larger and that there are smaller, but on average 7.3. And then we compare that to full term, and so the way we interpret this is, if this is a very different number, what it says is there's a lot of preterm deliveries, but it's a very similar number. So what it says is the majority of the patients that we manage have successful term deliveries, and that's a positive. We also kind of evaluate periodically if it's a boy or girl. How many of you know what you're having? Okay. How many are having boys? Girls? Okay, so more girls now, and then a couple unknowns. Well, we do know more than half of our babies currently are boys. I would say 5 years ago when we first started this talk, it was more girls. Now I think if we do it long enough, it's going to kind of regress to the mean. We're going to get 50-50 breakdown, but currently we have more boys in the practice. Okay, big question, very common. People really want to know, how do I know if this is the real deal? I don't want to miss it. On the other hand, I don't want to overreact. And these are really common concerns and obviously legit. So true labor, distinguished between false labor. True labor, contractions are regular. There is a cadence, there is a periodicity to them. You will feel discomfort predominantly within the abdomen, but sometimes in the back. But regular contractions are the key. The pain begins to intensify over time. Your bag of water may break. And they continue despite you doing palliative measures, soaking in a tub, taking a warm shower, trying to rest, hydrating yourself, other things. It will continue. And I guess the bottom line, in my opinion, is true labor, you won't miss it. You will know when this is the real deal. And a lot of times, what I try to do when I counsel patients that are concerned about this is to understand that I know that you're worried that you're going to deliver on John Nolan Drive, but it won't happen. I promise you, you're going to feel these contractions. They're really going to mandate your attention. Compare this to false labor. Contractions very sporadic and irregular. I once had a couple stay up all night with a legal pad recording their contractions, 7, 10, 12, 2. It was all over the map, and they were exhausted. And they came to see me the next day with the idea that I don't know, my contractions aren't really picking up, and that's because they're false labor. So what I'll tell you is if your contractions are irregular, carry on, business as usual. Don't feel like you need to stop everything and take note because it's exhausting. I promise you when they are regular and have meaning, you will notice. False labor also can hurt anywhere as well. You can feel discomfort in your back or in your lower abdomen. That is not really a discerning point. False labor subsides when people rest, hydrate, take a warm bath, change positions. So these are kind of helpful tidbits of information. A common thing, and we may discuss this again, but a common thing I'll tell women when I see them for their OB appointment is contractions should be every 5 minutes at term. Every 5 minutes for over an hour. They're really there to stay. The contractions last 45 to 60 seconds. And the contractions are very synchronized. They begin, they peak, and then they relax. And that cycle is a 45 to 60 second cycle. And the last is intensity. It becomes difficult to walk or talk during the contractions. So the litmus test is if you can look at your husband and say, hey, guess what? I'm contracting right now. It is not strong enough to dilate your cervix. When you have to tell him, hold on a minute, and a minute later you're able to communicate, usually that implies enough power to dilate your cervix. Prior to that, softening your cervix, allowing baby's descent, perhaps thinning your cervix, but you're not laboring yet. Okay, so the first stage of labor is from 0 to 10 centimeters of cervical dilation. Regular contractions that cause the cervix to change. There is no traditional or typical amount of time, there is no clock that says you have 12 hours to do this. It will not be that way. It will vary accordingly. First-time moms typically labor longer. A normal labor could be up to 24 hours for a first-time mom. It is typically shorter when you've had subsequent pregnancies. But everybody's different and every pregnancy is different. Monitoring, when you are at home, you are monitoring your contractions. You may notice that baby's movement continues, but perhaps is not as pronounced. So be aware of this. When you're in the hospital, we will monitor you either externally, listening to the baby with a dot tone, okay, which we do in the clinic when you come in, or an internal monitor, and we're going to talk a little bit more about those, which is a much more exact way of monitoring the heart rate and the contractions. Okay, so what numbers will you hear? When someone says, how dilated are you, or what was your cervical exam, there are a couple things we want to know. We want to know, how thin is your cervix? And this is the first thing that typically begins to change when labor evolves. The cervix begins to thin. The analogy I use is a turtleneck. When you pull a turtleneck on over your head, that too begins to flatten and then open. And that thinning, so that too begins to flatten out and shorten. And that's what effacement is. I think there's seats right up here.